Welcome to Love Bites. Love Bites. Love Bites. Love Bites. By Dr. Tara, your destination for sexual wellness and mindful relationship advice. Hope you're having an orgasmic day.
Have you ever wanted an STD test but didn't have time to go to a clinic? Now there is a solution. LetsGetChecked has an at-home STD test with fast results. It's simple. You order your test, collect your sample, and receive your accurate results online. They also provide medication at no extra cost for most states. There are also other health and wellness tests for men and women as well. Check out LetsGetChecked. The link is in my episode description, and the discount code is Dr. Tara. And have a worry-free orgasmic time. Hi, loves. Today, I have a medical doctor in the house. Dr. Madeline is here to drop some truth and knowledge and facts. Dr. Madeline, hi. Thank you so much for being here today.
Hello, Tara. Thank you so much for inviting me. It's a pleasure to be here with you, Dr. Tara.
So wonderful. Can you please tell us a little bit about yourself?
Sure. So my name is Dr. Madeline. I'm a board-certified OB-GYN, best-selling published author of the book In Control, international speaker, and also a former CDC medical epidemiologist. And so I absolutely love working with women and trying to make sure they have the most accurate information as possible so that they can be in charge of their sexual journey. And I love your podcast and everything that you're doing, because anything we can do to kind of expand that conversation and get more people talking about sex and sexual health, the better we'll all be. So thank you again for inviting me. Now, for those of you who aren't familiar with me, I'm on all social media platforms, Instagram, Facebook Live, and Twitter and YouTube as Dr. Madeline, MD. That's DrMadeline, MD. So thank you for the invitation.
Awesome. Dr. Madeline has, all the social media accounts that I'm going to be linking them in the show description for this episode.
Thank you.
Thank you for sharing, Dr. Madeline. I'm just so excited to get started because I love talking to an OB-GYN because I have so many questions. So shall we get started?
Yes, absolutely. Let's do it.
All right. So the first question, and this I have heard from so many women that I coach, as well as women in my classes, because, I'm a college professor. So a lot of students disclose to me like, hey, is this normal? So my question is, why does penetrative sex hurt for some women?
Oh, great question. So pain during or right after sex is really more common than you might imagine. We actually have a term for it. We call it dyspareunia. And there are a variety of reasons why someone might have dyspareunia or pain during sex. Many of them are physical, and then there are some that are psychological. So let's talk a little bit about what some of the physical things might be. So if someone has decreased vaginal lubrication, for whatever reason, you can have decreased lubrication when you go through menopause and your estrogen levels drop. You can have decreased lubrication when you're breastfeeding and also your estrogen levels have dropped. There can be a variety of things that might lead to decreased lubrication. So that's one of the things in the physical category.
I definitely have decreased lubrication when the man is being disrespectful.
Yes.
Like, you want to know why I'm not wet?
Okay, sorry. Man does not increase the WAP. Okay, if you want more WAP, then the man has to be respectful. The man, or whoever the partner might be, the partner has to be respectful. The more foreplay, the more WAP.
I want the WAP.
Exactly. Yes, we all want the WAP. A lot of my patients want the WAP, trying to get the WAP. So absolutely. The more WAP, the better.
The more WAP, the better.
One of the other things that can cause painful sex is infection. If someone has inflammation, if those tissues are inflamed, infection doesn't necessarily have to be a sexually transmitted disease. It can be something like a vaginitis that's not sexually transmitted. It can be, a parasite that might be around the genital area, vaginal or rectal area. So anything that inflames that tissue is also going to make it painful when you go to have sex. Another thing that can happen is people can have muscle spasms. There are muscles around the vagina area, and those can have spasms, and then that can make sex painful. And of course, a range of medical conditions. And then on the psychological, you have a variety of things that can cause someone to feel pain during sex, whether it's a history of sexual abuse or some anxiety or depression for a variety of reasons. A lot of things might manifest when it comes time to have a sexual encounter that may really have nothing to do with physical.
Wow. Mm-hmm. So is it possible to have, I wanted to ask more about the spasm. Is that temporary, or is that like genetic or something that you have for the rest of your life that you can kind of have to find a way to control it?
Most times it's temporary. Most times when I'm taking care of someone who is coming in describing spasms, they haven't been there her whole life. They may have happened after a certain event, or sometimes, you have to sit down and even review like what medication someone might be on, because sometimes things can be a side effect of a certain medication. So absolutely, spasms are something that can be looked at, evaluated. We can figure out what the root cause is. And then most of those women can do better once we figure out the root cause and remove that as a cause of the spasms.
Oh my gosh. I can't even imagine I'm being sick, taking medication, like I'm already sick. Now my vagina is spasming. What about the psychological stuff? So how do we know if it's physical or psychological, and what do you recommend to like figure that out?
Oh, great question. So I think the most important thing for anyone to realize if they are having pain during sex is that they do not have to just stay in that space, because sometimes people will feel very nervous about even talking about the issue, whether it's with a friend or a loved one or a family member, or even with their physician or other provider. So the first thing is to go see a provider, and that provider is going to sit down and do a full history before we even begin the physical exam. We have to do a history because we have to know, all those things that I was just talking about, what medications they might be on. If anything has changed in their physical history recently that we should know about. If they have anything psychologically going on that might be a stressor contributing to the situation, we have to know about that too. And so, by getting a full history, it helps us figure out if we need to think of a remedy or solution that might be related to trying to do medicines or anything like that. Or if I have to call up like one of my colleagues who's in mental health and say, hey, I've been talking to Miss So-and-so. Here are some of their concerns. I think this might be something where she needs to speak to someone and get some things off of her chest so we can dive deeper into what might be at the root of the pain. So definitely for psychological, I absolutely engage mental health support so that the person feels they have adequate resources to kind of talk through what may be going on.
Wow, that's such great advice. So
Absolutely.
For everyone that's listening, definitely go see your provider, because there has to be some type of like investigation almost, right?
Absolutely.
Of like your sexual history, your perhaps like psychological history, your current medication use, and all of that.
Absolutely. Absolutely. If there's ever been a history of sexual abuse or child abuse that's never been brought to the forefront, all of that is really important.
All right. My next question is related to STIs and STDs. Mm-hmm. And you're smiling because I feel like a lot of people probably ask you this, but I can only read so much research, and I just want to hear from you. What are some of the most common STDs, STIs in the United States?
Okay. Well, great question, Dr. Tara. So I'm going to answer it based on incidence. And for your audience, that just means that I'm going to answer it based on what's most common based on new infections. Because, their CDC, when they calculate these national estimates, they look at what's going on across the board. And then they also look at new infections. And new infections, I think, are interesting because it's like, what's most related to our most recent sexual activity,
Right. Yeah. So, what are we all up to?
Right. Exactly. So importantly, they look at these estimates every single year for, since like the early 1930s, 1940s.
Wow.
And I think what's really important for the audience to know is that STDs have increased in this country every year for like the last 6 years. So when CDC did their most recent set of estimates, they actually said that 1 in 5 people in the country has an STI. So 20% of everyone walking around has an STI. So if you have like 5 partners, chances are one of your partners has something, or maybe you're the one who has something.
Yeah.
So, it's just an interesting to think about. That equates to about 68 million people in this country. And so when you look at what's most common in terms of new infections, HPV or human papillomavirus, which is significantly decreased if people get the HPV vaccine. Trichomonas is one that people don't really think about as much, but trichomonas is very common. It's the second most common STD in the country as of 2018, 2019. The third most common one is chlamydia, fourth most common gonorrhea, and fifth most common is herpes.
Wow. So I have had chlamydia, so I know I'm a part of the 1 in 5 people.
Only if it's a new infection. So
right.
The top 5 that I just mentioned, those are new infections. Yes.
Right. Yeah. So I wanted to ask about this number 1 infection or virus, right? HPV.
Yes.
Is HPV deadly?
Not usually. So HPV or human papillomavirus is most commonly, we have so many types of HPV, over 40 types of HPV are out there. There are some types that are associated with some cancerous conditions and outcomes, and most are associated with benign things like warts, which are not gonna not gonna kill anyone. So are they deadly? If you have an HPV type that's associated with a cancer, and if you acquire cervical cancer still kills several thousand women in this country every year. So yes, it can be. HPV also in men is associated with penile cancer, and men and women is associated with anal cancer, and men and women it's associated with throat cancer. So yes, it can be deadly. We're seeing less cases going to death as more people get vaccinated, and we have overall less HPV kind of circulating in the population, but it can be a deadly cancer. I think it's one of the reasons why when we talk to parents about the HPV vaccine, because it's recommended, it can be given as early as ages 9 or 10, but CDC recommends ages 11 to 12. When we talk to parents, we're saying, no one's saying that your child is going to start having sex. We're saying that when and if they start having sex later in their teen years, they'll be protected against HPV, so that they'll be less likely to acquire they'll be less likely to acquire a cancerous form of HPV and then have a bad outcome.
Oh my gosh, everyone who is listening, get the HPV shot. And if you're parents, let your child get the HPV shot. So then my question would be, can you get the HPV shot if you already have HPV?
Great question. Yes, you can. So because there are so many types of HPV, and because the vaccine will help you with, like 4 to 6 certain types, depending on which vaccine you get, there's still always going to be some benefit to getting the vaccine, even if you've had HPV. So, at first, the vaccine was only FDA approved up to age 26. And in the last few years, they approved it up to age 45. So sometimes, if I'm seeing one of my ladies in the clinic and she has concerns because her last pap smear was abnormal because of HPV, she might still qualify for the vaccine, depending on which type of HPV she had. So absolutely, get that HPV vaccine. It might still help.
Wow, that is such great knowledge. All right, y'all, you heard it here first. Go get your HPV shot. And you said that the CDC has increased the age to 45, right?
Yes.
So you can be 40 years old and concerned about HPV and get the shot.
Absolutely.
Awesome. Okay, well, this next question is a little comedic, but I do get it all the time. It all the time. Okay. And I'm like, okay, I have a PhD and I'm a college professor in sexual communication, but let me ask an OB-GYN. Is it medically possible for men to grow their penis via pills, pumps, or surgery? So can you get a bigger dick through pills, pumps, and surgery?
You cannot get a long-term bigger dick through pills, pump, or surgery.
All right. Okay. Well, you heard it here first. Not a long-term solution.
Right. So, there are many studies that have tried to look at this over, many different years. And, of course, because wouldn't it be a great thing? Wouldn't men love to have something out there? And maybe some women too. I won't discriminate. There might be some men and women that would love to have the ability to enhance the penis.
Right.
And, whether it's pills, creams, devices, surgeries, nothing has been shown without a doubt to last long term and scientifically, compared to baseline, enhance that man's size, whether it's length or girth over time. Now you have some short-term solutions. You have, different pills they can take, and they can get increased blood flow to make the penis more erect and firmer, which is certainly something that gives a short-term benefit in terms of, bigger size and everything and harder erection. But the science shows, the data shows that no, that stuff doesn't work. And they have many different surgeries out there. And very few are considered medically necessary. Medically necessary is only if someone has a technical micropenis, which is 7.5 centimeters or smaller. But everything else is just cosmetic. And so the surgeries are not recommended in those situations because, they're not guaranteed to work. The recovery is just, it's harsh. You would be looking at 6 to 8 weeks of trying to do nothing but allow it to heal. And, you can't have sex. You shouldn't have sex because you can cause the area where the surgery occurred to, break down again. So yeah, it's a great question, but no, nothing yet is out there. Okay.
So in summary, you cannot get a larger penis from pills, pumps, and surgery, and in a long term. Right. But you didn't mention about micropenis. You mentioned about micropenis. So is there surgery to increase the size for micropenis?
There are some surgeries out there for something like micropenis, which, for them to recommend that surgery and it to be medically indicated and insurance covered and all of that.
Right.
The penis literally has to be 7.5 centimeters or less. And some of the surgeries that they do, one is similar to breast implants. You can have a silicone rod.
Right.
It can go into the shaft of the penis to try to increase the girth. There are some surgeries, and that one has one that's FDA approved. It's called Pneuma. It's FDA approved. The silicone implants are FDA approved.
Interesting.
Yes. For that particular surgery for micropenis. There are some surgeries where they do fat transfer. They take some fatty tissue from one part of the body and put it around the penis to increase the width and some of the length. They have some surgeries where they try to cut the ligaments to try to allow it to be a little bit longer. Those, though, aren't, I think those are ones that aren't done very often. The science does not support those as being effective.
Yeah. And it sounds very invasive.
Yes.
It's you have to make this big decision. Do you want to do this? Exactly. Most urologists, now, these are not done by OB-GYNs, but urologists who do them, many of them will say that if the person is functioning normally in terms of urination and sexual intercourse, that they really should think long and hard about whether or not they want to have surgery, because surgery is no joke. What if they can't think long and hard? All right, well, jokes aside.
Exactly, Dr. Tara.
Well, jokes aside, I do want your advice. How should one go about ensuring their sexual health and wellness? Let's say you're talking to a 21-year-old, right? Starting to be sexually active, casually dating people, and just exploring. How can this person ensure their sexual health and wellness?
Well, Dr. Tara, I love that question because absolutely, I tell all women this, you have to start with yourself. You know, we're not, society-wise, community-wise, we're not given enough time and space to just know who we are as sexual individuals before we kind of venture out into the world. And so I would tell a young woman, I tell my patients this, get to know your body. Let's talk about the anatomy. Let's make sure that you're calling everything the appropriate name. It's okay to say clitoris. It's okay to say vagina. It's okay to say vulva. It's okay to say penis. Talk about all those things and then explore your body. What makes you feel good? Know yourself. What brings you pleasure? What doesn't bring you pleasure? Once you know those things, you can communicate to your partner when and if you get a partner. If you don't get a partner, then you're still good because you know how to make yourself feel good when you need to.
Oh, hell yeah.
So that's what I tell my ladies in terms of how to think about sexual health and wellness. Know yourself first. And then once you know yourself and when and if you decide to have a partner as part of your sexual journey, then share what you know with that partner so that they can know what your pleasure points are, talk with them about their pleasure points, and really try to make it something that's interactive and mutually pleasing. That should be one of the goals if and when someone gets a partner. And if they don't get a partner, please yourself as often and as well as you like.
I love that advice and I resonate with it so much. I always tell my audience and my students how important it is to self-explore.
Yes.
Because people take it for granted. They think that sex is something adults do and you kind of just turn into an adult and know how to do it and know how exactly to do it, what to feel. And it's just definitely not true.
Exactly.
There are people, I'm sure, in their, 50s or 60s that are not having good sex because they haven't even explored themselves.
Girl, say it again.
Yeah. I feel like that's a fact. That like a lot of older people, they kind of just gone through life without sexually exploring.
Mm-hmm. Mm-hmm.
And just, sex is, penetration and it's 5 minutes and then you're done.
Right.
Yeah. I love that.
Much more than that.
Self-exploration for your sexual health and wellness.
Absolutely.
Awesome. So I guess one of my questions here, my last question before we go into our fun segment is what's the one question you get the most as an OB-GYN?
Oh, without question, Doc, am I pregnant? One of the reasons I wrote In Control is because I really see in my clinical practice and even when I'm talking to people out, doing talks and everything, not enough people have enough information about birth control, the different options, how they can be used, how they can protect someone from having an undesired pregnancy or an untimed pregnancy. And I get that question a lot because, when you think about it, Dr. Tara, if most women or girls are having their first cycle by age 11 or 12, and if most women in this country are going through menopause around age 51 and all those years in between, so that's about 40 years in between when most women, if they're ovulating regularly, they're releasing eggs and, they can, if a sperm meets up with that egg, that's a pregnancy that can happen a lot of times in 40 years. And so what we don't talk about enough in this country, I think, is that most women spend the majority of those 40 years trying to figure out how not to get pregnant by mistake. Right. And so it's absolutely true. Women ask me more about pregnancy than even STDs. When people are having sexual intercourse, heterosexual intercourse, they're most concerned about pregnancy. And so I get that question a lot. I talk with people a lot about different birth control options that might be specific to them based on their history. The fact that even with some birth control options, except for the condom, which protects against pregnancy and STDs, most STDs, but not all. For most birth control options, you should also use a condom so that you don't mistakenly get exposed to or transfer an STD, which includes HIV. And so I love having those sexual health conversations with people, after they do the self-exploration and get to know the partner and figure out what their desires are, really talking with them about protection. What does protection look like for you? And more so, what does worry-free, joyful sex look like for you? I try to put it in positive phraseology. For more worry-free, joyful sex, what do you need to have that? What does that look like for you? And if one of those things for you to have to be more worry-free includes birth control, then we talk about what birth control option might be a good fit for you. And so yeah, that's the question I get all the time. Doctor, am I pregnant? Even if they've done a pregnancy test at home, they want to double check. Maybe they don't believe it.
Yeah, I'm a part of that statistic. I have asked my doctor that as well. Well, I guess, okay, the one quick question did pop up because you were talking about birth control. And I know that a lot of young people, if they haven't had this proper communication with their partner and they do have pregnancy scare, they tend to take Plan B. What medically, what are some outcomes, or if there's any associated risks for taking a lot of Plan B? And what is a lot?
A lot is still kind of subjective.
Right.
What I tell my patients is that if they've had 2 to 3 or more scares, then let's talk about something preventive. Because it's easier to prevent the pregnancy itself by either being on a regular birth control pill or having an IUD or the Nexplanon that goes into the arm or any of the options that are out there. There's a vaginal ring. There's so many different options out there. It's better to have something already on board than to have either the condom break or for it to feel so good that the condom never gets put on. And so that's usually what I tell them. And so, yes, you can go to Plan B and most drugstores in the country and purchase the Plan B and take it as prescribed. But absolutely, if I have someone come in to see me and they've recently had a scare, or maybe they've had 2 and now they're coming in to see me, we have a long talk about, okay, this would be better than that in terms of planning for the future. And most times people are receptive because, they don't necessarily enjoy running to the drugstore and realizing that, they just had something happen that could potentially lead to an unplanned pregnancy. So, they don't enjoy running to the store. They have much more peace of mind if they know ahead of time that they were doing something that could have prevented it.
Oh, that's such great advice. So have a Plan A so you don't need a Plan B.
Right. Exactly.
Oh my gosh. Thank you so much, Dr. Madeline. I do want to move into my next segment in which I do it with all my guests is playing a little game.
Okay.
And so I'm going to basically tell you a word and you tell me a response of whatever that comes to your mind.
Oh my goodness. Okay.
So we're going to play 10 Quickies with Dr. Tara.
10 Quickies. I like the title.
All right. Are you ready?
Yes, I am ready, Dr. Tara.
Water-based lube.
Sex toys.
Coconut oil as lube.
Flavorful.
Olive oil as lube.
Slippery.
Massage candles.
Sensual.
Squirting.
Highly desired.
Vibrators.
Lots of fun.
Polyamorous relationship.
Do you, boo?
Getting STIs and STDs checked regularly.
An outstanding plan.
Daily masturbation.
Usually required.
Yes, you're speaking my language. Okay, my last statement here is best sex is based on
worry-free joy.
Oh, I love that. Worry-free, joyful sex.
Yeah.
Awesome. Thank you so much, Dr. Madeline, for being here today.
Oh, thank you so much, Dr. Tara. I had a great time.
Do you have any last words?
Well, I, again, appreciate being invited here. And for anyone who's listening, if you would like to follow me, I'm available on social media platforms as Dr. Madeline, MD. DrMadeline. Oh, and I also want to say, if you're interested in learning more about the different birth control options, if you were listening to this segment, I wrote a book called In Control, and you can get it at incontrolbook.com. And if you do happen to read it, please leave me a review on Amazon. I'd love to hear your thoughts.
Awesome. Please do that, y'all. And thank you again, Dr. Madeline.
Thank you. Thank you so much, Dr. Tara. I enjoyed it.
Bye, loves. Have an orgasmic day. How amazing would it be if you don't have to hold your vibrator? Let me introduce you to Eva by Dame, hands-free vibrator. Eva is a hands-free, waterproof couples vibrator that gives you clitoral stimulation during penetrative sex. You're gonna feel so good while Eva stays out of the way so you can focus on the moment. Use the link in this episode's description to the product page and use my discount code Dr. Tara for 10% off. Have an orgasmic time.
Thanks for listening. This was Love Bites.
Love Bites.
By Dr. Tara. Follow Dr. Tara on social media at lovebites.co. Have an orgasmic day.